You really have to think twice before you really reveal to a patient that you have to amputate them. My name is Dr. Rotich Geoffrey. I'm an orthopedic surgeon working here at St. Luke's Orthopedics and Trauma Hospital in Eldoret. Mobility, actually, one can describe as the ability to move from one point to another. But for a person to be able to move from one point to another, you need to be having all what we call equal limbs. What I mean by equal limbs is your upper limbs should be both working and your lower limbs should be working. When we talk of amputation, amputation is not something that one really likes to be told, especially if a patient comes to the office and you see their limbs and it's in a very bad state. As a surgeon, you really have to think twice before you really reveal to a patient that you have to amputate them. Because one, these are patients who don't even know what it will be like to stay without a limb, leave alone just not being able to do anything. You know, they are used to having it every time. So to bring these patients to the point where they understand that losing the limb that is causing a problem to them has to happen now, it's a very difficult process. And so what we usually do is we do other investigations that makes this patient really understand why they have to be amputated. And one of those is either we do laboratory studies, we do imaging studies like CT angiograms, Doppler ultrasound, just to verify or to confirm that the link that they are attached to is having a problem or cannot be salvaged. And the moment you confirm that the link has a problem and needs to be amputated, these patients have to go through counseling session, whereby we bring in a counselor who makes them really understand why they have to be amputated. We advise them that there is a prosthesis that can be used after losing the leg, be it that the amputation is at the level of the foot or the level below the knee or above the knee. They are still able to get prosthesis that can make them be active in their lives and perform different duties. We've seen people who've been done amputation and they are able to go back to sporting activities. We've seen people who have no limbs that they are able to drive. We've seen people who lose their limbs and they are still able to provide for their families. So it's not loss of life. It's just that it's a process whereby one goes through as a healing moment whereby they've had another condition. The experience that I have with the sac leg is that it gives a good result in terms of mobility. It gives a good result in terms of shape because you are able again to stand like everybody else. It gives a good result in terms of, let's say, when we are traveling here in our transport system, which involves you have to sit for long hours, you are able to fold your leg almost at the knee region. So it's a component whereby one is able to use very comfortably. Of course, there are instances where you need to redesign sometimes because of maybe different shapes or adjusting to the conditions that is within that prosthesis. And that is the only difficult part. Otherwise, most people are comfortable with it, they are happy with it, and they are able to do their daily chores.